slower improvement with what I do, okay, with our interventions, but longer lasting effects. Okay, so I am not a stimulant medication, meaning I can't, within a certain number of hours, bump up brain chemical production. Okay, can we see sometimes really dramatic changes? Absolutely. But it tends to take just a little bit longer. Okay, it tends to be more of a process of getting that brain that may be 3 years behind on developing a year and a couple months rather than kind of lagging behind.
And you can't replace any lack of movement that goes on between adjustments, too.
Absolutely. That's the key. That's one of the hardest things I deal with is kids with issues with attention and focus, and have parents that have issues with attention and focus. And so I always say, if I give you a list of exercises, things to do, and you don't do them, tell me. There's not a grade. You're not going to get an F if you don't do these activities. But if you're doing them and you're not improving, it's different than if you're not doing them and you're not improving. Okay, so if you can't do something, tell me, and I can kind of modify it to hopefully get it to where it's easier to do or something that you can remember to do. Okay. Chiropractic adjustments should be safe, not painful. It's something that kids typically giggle and laugh when I adjust them. I have more kids cry when I adjust mom than when I adjust them. They want mommy to hold them, and I'm adjusting mommy. So the pressure we use to adjust a little tiny one is actually less than the pressure we use to feel an adult spine. Okay, so I've adjusted tiny ones as young as 5 days old in the office. Okay, I've had patients as old as 99 that I've worked with. We modify what we do based on the patient, the size, and what we need to work on. Okay, and our goal is to improve the overall health and nervous system. Okay, so hopefully I got you all looking at ADD a little bit differently. Okay, more than just a group of symptoms, but it's actually a group of symptoms linked to functional imbalances in the brain. Okay, how the brain is working, how the brain is controlling the body, not just chemical imbalances. Chemical imbalances are actually due to the functional imbalances. If we can improve how the brain is functioning and also improve the fuel supply to the brain, we can oftentimes make huge improvements. Our goal is to treat the cause. Chemically altering the brain doesn't really correct the problem. Psychotropic drug use may lead to adults with no built-in abilities to deal with stress or sadness. We did a study in 2004 where the National Institute of Health showed that early Ritalin use may cause long-term effects on the brain. Test subjects showed reduced ability to experience pleasure and reward, and were more prone to express despair-like behaviors in stressful situations. There's also a study just out this last year where West Australian Department of Health showed children who use medication to treat ADHD were 10 times more likely to perform poorly at school than the kids who chose other treatments. Okay, so I'm not saying don't do anything. You need to do something to help bring them up. But I actually have a study that did 2,800 kids over 20 years, and actually showed that kids that were medicated were 10 times more likely to perform poorly. So you start going, well, I don't care if my kid sits still and is less disruptive in class. I care more about what they learn. It's teachers have to maintain control and order, but that's secondary to my child learning what he needs to know. Okay, so if they're going to not perform as well, I'm going to choose other options. Drugs are not specific on where they affect. Through neurology, chiropractors can definitely make permanent changes. That's my little girl. So. And first steps to change, typically what we do is dietary evaluation and management. We'll also sometimes do food logs for kids and adults, looking at what they eat. It's amazing how many times I get no breakfast. I don't care how many times I get, what they have for breakfast. And unless the child is at a thriving age, the parents are the ones who buy the food. So I'll say, get a bag. If it's unopened, donate it to someone else. That's a good idea. It's not good for you, but throw away the stuff that you shouldn't be eating. But it's something that you have control over what they're eating. Okay, and the worst thing that can happen is you monitor and improve their diet. And the worst case is you're healthier, and the behavior doesn't improve. That's the worst outcome. Yes?
What's interesting, it's probably covered in the grocery tour, but most breakfast cereals, sugar is either the third ingredient or the second ingredient.
Yeah.
And this includes some of the healthier type cereals.
Oh, yeah, and you look at some of the artificial colors that are in those. It's part of this wholesome breakfast, and yet they have to have milk and fruit and all this other stuff with a bowl of cereal because it's mainly sugar. And you get into grains and cereals that are real refined or basically sugar.
Mm-hmm.
Okay.
It's just surprising.
So yeah, Secondary is neurological chiropractic evaluation. Typically, it takes about an hour. We go through where I'll look at balance and coordination, but any of the doctors here can look at subluxations, misalignments in the spine, posture, and looking at changes, and come up with a treatment plan to improve how their body functions as well as how the brain functions. Okay. Well, thank you very much for all your attention. Any questions?